So this brings us into the next stage, which is then one of corporate governance. And on page 302 in our pack, we have a board assurance framework. Hannah Hamilton, you're not only our Chief Finance Officer, but the Senior Executive responsible for governance. You can assume the board has read the papers. We know that the committees have gone through the BAF as well, as we call it. But are there any key points you want to bring to the board's attention?
I think just to say briefly, this it articulates the work that was done during October and the strategic developments and achievements in that during that time as well. But also there are a couple of areas of challenge in there. So I think particularly around the financial risk, the year-to-date financial performance remains as a risk in there, and around workforce numbers and funding to support the levels of workforce we need. So I'd pull those out as still being sort of BAF challenges. As at the 24th of October, when this was done, there were eight scores that remained unchanged, and 2 scores were reduced. And then, of course, this goes through committees, and as we said, the Finance and Outcomes Committee won't have looked at their BAF yet as well, just because of the timings. And all the progress against all the mitigations are all shown in the report, and we've got the operational risks that are 15 plus, and the mitigations in here as well now.
Okay, well I think for those of us that like detail, there's lots of detail in the BAF in terms of the specific mitigations, so I'll assume they've been read. Just to be clear, I did note that in the People and Digital Committee, there was the committee rule in your particular report on page 152, you were content with the proposal to reduce the system workforce and people risk, but you asked for more mitigation to be presented to the committee on the on the digital and data risk.
Yes.
So, what is your recommendation to the board?
Our recommendation, well, my recommendation, or the committee's recommendation, is to continue to maintain it at 16 for now, until we see the evidence that the mitigations are in place that warrant it being reduced to 12.
Okay. So your recommendation as a committee is not to reduce it as to the System and Digital Data Risk ICS 007 from 16 to 12 as is in the paper. So you need some further assurance before you can support that.
Yes.
Right, just to be absolutely clear, on the System, Workforce and People Risk, which is ICS 010, you were content for that risk to be reduced?
Yes, because the evidence was provided within the paper for us to.
Okay, so I think that's an important piece of context for us to note before we make a decision. Can I just check if there are any other questions around the board assurance framework? Lots of people. Sue, why don't we start with you?
Thanks, Chair. And I think it's really good. It shows that it's a dynamic document because we've got new gaps that are being identified, and I think that's really important as we move forward with new policies, frameworks, etc. that we're picking up on that. And my specific question was around risk 005, around we've got a 6-month gap or delay in the recruitment and selection policy, and yet we've also reduced the risk around workforce, and I'm just wondering what the impact of that is going to be, if there is going to be an impact, and whether that's been taken into consideration when we've looked at the risk.
Okay, Mark?
Yes,
Chief People Officer?
Thank you, Stephen. Thank you, Sue, for the question. So, yes, we have absolutely looked at that. From a recruitment and selection policy, we have gone back over that and made sure from a legal perspective everything is as it should be, as you can imagine, from a reasonable employer's perspective. But the reason for the gap in the policy for us at the moment is that we've taken a huge amount of learning from our change programme, and we want to make sure that we don't lose that and we adapt and adopt that into our new policy moving forward. Items such as ensuring that our recruitment and selection processes are open, transparent, which of course they are, but also that we put additional measures in with regards to equality, diversity and inclusion that we capture and we continue in that space too. So that's a difference in that space. On the risk reduction perspective, the risk reduction from 20 to 16 is in 010, so 110, which is more system-based workforce as opposed to NHS Sussex.
Okay, brilliant.
Okay, great. Claudia, you had a point?
It was just conscious of the conversation we just had around strategic commissioning, and we've got it as one of our highest rated risks in the BAF as it currently stands. I think the agreement around the commissioning framework that we've just made, I would expect to see a reduction as long as we don't have something that works in the opposite direction. I think when we come to the next iteration of BAF, and I think then the next fundamental change will be around the C4ILT programme and making sure that we've got all of our staff appropriately skilled to deliver.
Great, okay, so that I think is quite a helpful explanation on strategic commissioning. We'll come back to some of the others in a moment. But Rahul, do you have a question?
Yes, Chair. In relation to Adam's emphasis on the importance of clinical leadership within the system, at the PDC, we discussed the unsuccessful recruitment of a Chief Clinical Information Officer, and obviously I'm quite keen for that post to be populated and actually to join the People and Digital Committee as well moving forward, so that any changes that are undertaken from a digital perspective have that clinical oversight as well.
Okay, great. Okay, James, do you want to come in on that?
Yeah, so we are very much mindful of that vacancy. We've been out to advert twice unsuccessfully. We're looking at innovative solutions to try and develop some recruitment. We've also got someone who's already working in the research and innovation space who may be interested but not quite yet because of other commitments that they've got. So, but if we can get the right person, we'd rather wait a little while.
Okay. Okay. So, Adrian, you want to come in on that?
So I think that probably it's a data point, right?
Yes.
So we've been out twice and we can't recruit to it. So what's that all about? I think is the question. I think we need to go back and look at. So I think we need to go away as the exec team and look at what time and energy are we spending on the wider digital and data agenda? Because you would think with this transformative strategy, people would be desperate to be our Chief Clinical Information Officer, but clearly they're not. So we have to ask ourselves that question as a group, be clear what we need to do to get that piece right. So I think if we can sort of take that back as a collective action, I think it might not just be clinical, there's probably something more culturally going on.
Okay.
We need to unpick to get right.
So you'll do that through the Executive Committee?
Yes, you will.
So that's just an action for the Executive Committee, Kerry, just to review the clinical information post. And actually what's going on there. Is it a specification issue? Is it a profile issue? Whatever the reality is. Okay. Colleagues, any further comments? Can I just ask in terms of, if I look at the red risks that are stable, Claudia's helpfully already covered strategic commissioning, and it's expecting a reduction there. I think in terms of the capability and people, that still seems relatively high mark. And I just wondered in terms of what's happening with that. Are the mitigations working? Is the target score wrong? Why we're not making progress in that area?
Thanks, Stephen. So this is an area that we're working on through the Commissioning for Improved Lands Together programme around our OD. This is for NHS Sussex specifically. And as we start to embed that programme more fulsome in the organisation, we can then see that there will be an increase in capability and a reduction in risk.
Okay, so I can see the path to that. On system finance, obviously, just from a timing point of view, the Finance Outcomes Committee hasn't formally met, but will meet before we come to January. But Louise, just from a committee perspective, how are you going to sort of seek assurance on our financial position?
So we had an informal meeting of the Finance Outcomes Committee yesterday, and I think in private board we're going to be having a discussion on that. Hannah presents a paper and will present the latest position and how well we're doing on the bridging on it towards trying to get to the control total, or where we'll be on that at the committee, and we'll have a full discussion on that. And then we'll look at the BAF in relation to that discussion. Okay,
that's helpful to understand that we're not just ignoring it. But Hannah, I know there's a lot of work going on in this area, trying to get the finances into achieve our plan. Do you want to just quickly summarise some of the activities that you're doing?
So yes, we've put together a 7-stage recovery plan, which we submitted to NHS England at month 4, and then updated it at month 5. And I've had a meeting with NHS England at month 6 to talk about all of our recovery activities. So I think all of this is reflected in the BAF that you see here. So we are continuing that with those recovery actions. And I mean, it's fair to say we are facing financial risks that have come to light since planning. So this is where why the work is ongoing as part of the recovery plan to aim to mitigate those risks. So this is why the risk score stays high whilst that work is ongoing. But we will take more detail to Finance Outcomes.
And I think it then needs a proper review by the Finance Outcomes Committee. We've got time to review that in breadth and then report back at the next board. So that feels like the route to solve that one. And then in terms of system, workforce and people, that's the risk that we talked about. So that will continue to stick with the People and Digital Committee until you've received the assurance there, which hopefully will come. So, but that feels that we're identifying the key risks, and then what are we doing about each of them, I think, as far as that's concerned. So can I just check, is the board content with the board assurance framework in its current form? It is a dynamic document, as Sue rightly said. It will continue to evolve and it must continue to evolve. Okay, thank you for that. Therefore we can note that as approved. So that brings us into the final section, as it were. And that is actually one of public questions. We've had a number of public questions that have been submitted to us that are related to today's agenda. We've got time, I think, probably for 4 of those, but what I can say is that all of the questions that have been submitted will receive a written response. So, question number 1, within the terms of reference of the various delivery boards, it was stated that the complete clinical pathway and patient's life course will be included in any change of practice. Is this statement of intent still central to everything that the integrated care system is undertaking, especially in the development of integrated community teams and the foundations for strategic commissioning? James, as Chief Medical Officer, would you care to answer that?
So I think the simple answer is yes, absolutely. We are committed to an approach that reviews from cradle to grave. If you think about the ICT, it's all based on population health outcome, and actually that addresses starting well, living well and dying well. What I also feel is that this is absolutely aligned to our 5-year strategy of improving lives together. So absolutely, I think it's covering all elements of an individual's life, and we will address all of the health and care issues throughout all of those periods.
Great, and I must admit, I think from a personal point of view, I thought there was a very strong clinical voice through many of the items of today's agenda, so I think that gives us further confidence that we're very serious about delivering on that. Okay, the second question was, has any consideration been given to co-locating NHS and adult social care staff in a central Sussex transfer of care hub to enable better and more productive communication between the two organisations when dealing with patient flow to discharge? Amy, as our Chief Integration and Primary Care Officer, do you want to take that one?
Yes, and thank you to the member of the public who gave us the question. It's a really good question. We are testing that approach actually in the Brighton and Hove Transfer of Care Hub, where we're going to have social care and NHS colleagues working in the same office to see whether that has improved outcomes in terms of the joint processes that we follow. I guess what's also important to say is that we do have close working, even if it's virtual, in the other transfer of care hubs, and we have got an action plan to improve how all the transfer of care hubs in our system are moving forward by the end of the financial year.
Correct. Okay, thank you for that. Mark, you want to add something to that?
Yeah, just to add, from the East Sussex perspective, we're also looking to actually physically locate social workers within the 2 transfer of care hubs within East Sussex Healthcare Trust. Certainly at the DGH, they're already next door, so physical proximity is already achieved. But I think, as Amy says, it's the close working that goes on beyond the talk that is important.
Okay, thank you for that additional point. Okay, so the third question we received is, will all frontline staff across all providers be given the opportunity to participate in the design of the collaborative working strategies and be recognised as the owners of those strategies once deployed? So, Angela Stevenson, as our partner member today, could you answer that one for us?
Thank you, Stephen. I think that all our organisations, despite their nuances in terms of their makeup, are clinically led and seek to ensure that there's clinical and operational colleagues involved across all levels of the organisation in the design of any changes that are taking place, but very specifically in the design of collaborative services. Ownership is disseminated through the organisation via divisional structures, and therefore those clinical leads owning those strategies once they are designed, and indeed what comes with that, which is their implementation.
Great. Okay, thank you for that. So, and again, I think through the meeting today, we've also had a number of examples of what's the impact on staff through this. So, I think that's very much front and centre. Jane, were you going to add something to that?
No, I was just going to add that I think we saw a demonstration of that earlier on in the meeting where we moved from through the 4 in Brighton and Hove to 1. That came through clinicians and through people on the ground saying it's not going to work. So I think we've got a practical demonstration from across providers where we've demonstrated that already.
Okay, thank you for that. That's a very helpful intervention. And then the fourth question that we've got today is: has the reorganisation undertaken through the change programme impacted on the delivery dates of the elements contained in the shared delivery plan? Mark, can I maybe come to you on that one?
Yes, thank you, Stephen. Again, a quick answer, which is no. But the only thing I would just add is that the delivery of the shared delivery plan deliverables, too many deliveries all at once, are not solely dependent on NHS Sussex. It's a partnership approach in terms of delivery across the health and care system. But no is the quick answer to the question.
Great. Okay. So, thank you for the questions that have been raised. As I said, we should note those in the minutes, and then the other questions that were pre-submitted we will answer in writing separately, as they were generally more specific. So, just before we close, just want to draw the board's attention to the board forward plan on page 338. If I look ahead to the next meeting on the 29th of January, which will in fact be held in Lewis, in addition to the standing items, we'll have the next steps on delivering improving lives together. There's the clinical outcomes paper that we described earlier. I think is important on that. We'll talk about people plan, the delegation of specialised commissioning, the planning round and the planning guidance for 2025-26, some updated policies, and an important report from our Freedom to Speak Up Guardian. I think in addition to that, I think we also, I've added on during the meeting, the impact of the new NHS England operating model on NHS Sussex, just to complete the loop in terms of that, and that's very much linked to the planning guidance, I believe. So that's what's proposed in January, and then the other thing that we've discussed during the meeting is adding on a digital technology strategy, but we'll work out the right timing for that outside of this particular meeting. But with those particular notes, can I just check the board is content with that? Is there anything else that you think we should be discussing that is not listed on here?
You did mention the neurodivergence.
And there's a new, so I knew that, I couldn't remember, sorry Louise, your memory is better than mine. And there's also, we need to come back with a plan for the assessment of the neurodiverse population.
I just agree that I don't think we agreed to come back in January with that.
No.
The exec committee will look at it, so shall we mention the action is the exec committee report updates on the plan regarding neurodiversity.
Yes, exactly, to be specific. Okay, perfect. So we'll therefore approve that particular plan. Okay, so that brings us to the few closing remarks, if I may. So I'd just like to thank everyone for your contribution today. I think we've covered a really wide range of agenda items, and I think we've done that in a really comprehensive way. So thank you for your involvement. Thank you also to everyone who's been involved in writing the papers and also organising the meeting today. As I said, the next meeting held in public will be in Lewis on Wednesday the 29th of January. But before I do close, can I just say how proud I am of the way that the NHS in Sussex is responding to the growing demand for our services from an ageing population with multiple long-term conditions. And in an operating environment that's got a limited number of talented staff and a really finite amount of public money. But also the way that we're working as a system, because it's not just about the NHS, it's working with local government, it's working with the voluntary sector, it's working with all our other individual NHS partners as well. And I think it's that teamwork, that collaboration that has enabled us to have a really clear plan for our population of how we're going to improve health and care services in Sussex. And of course we've called that Improving Lives Together, which has been referenced throughout today's meeting. I'm also really pleased that it's consistent with the government's ambitions for the 10-year health plan, and moving care out of hospitals and into communities is completely consistent with our now 30 integrated community teams. Moving from analogue to digital, and that's come up several times today, by making better use of the technology and data to help improve the efficiency of our services, but also the experience of our patients. And moving our whole agenda from the treatment of illness to prevention, and again there's been several examples today where prevention has been mentioned. Of course, all that means that we do need to continue the work on improving population health outcomes. The population data is crucial to that. Our work on continuing to reduce health inequalities, maximising value for money, and of course supporting social and economic growth in our communities. The four core purposes of why integrated care boards were set up in the first place. This is a huge task. It's a major responsibility, but we can do it if we do it together and we work together as well as we have been in recent months and in the last couple of years. So I think with that in mind, I feel really optimistic that we do have a plan and that we're going to deliver it. And that's what gives me real confidence and hope for the future of the NHS in Sussex. So with that in mind, I'd just like to again thank you for your involvement today. Thank you for watching online. I'd now like to close the meeting and wish you all a very good day. Goodbye.